In your opinion, do doctors and physicians, do they make more money when I'm sick, or do they make more money when I'm healthy?
This is because the conventional fee-for-service model reimburses providers based on the number and complexity of services rendered. In other words, more treatments and more interventions typically translate into more billable services. That said, it's important to note that this is a systemic perspective, not necessarily an individual doctor's personal motivation. Many physicians are genuinely focused on patient health outcomes rather than just revenue. Additionally, some healthcare systems and insurance models are shifting towards value-based care, where providers are rewarded for keeping patients healthy and preventing illness, rather than simply treating them when they are sick. In short, while the traditional financial structure of healthcare can incentivize more treatment, there are also efforts to align incentives toward maintaining health, rather than just treating disease.
Yeah, my last question to you is, would it would it also be profitable for a physician that would give me advice that would keep me in poor health, since that would generate more profit for them over time? Or would the incentive be for them to cure me one time and I never have to come back to them?
However, that's not how ethical medical practice works, and it's not how the vast majority of physicians operate. In reality, the ethical and professional standards of medicine prioritize patient well-being and health outcomes above financial incentives.
Well then explain the physicians that are convicted for medical malpractice, or for prescribing, or for misdiagnosing patients on purpose to generate kickbacks or profits. Can you look up those types of numbers, and can you explain those, if being ethical is a part of the profession?
In summary, while the vast majority of physicians aim to act ethically and in their patients' best interests, there are indeed documented cases of misconduct. For instance, in recent years, hundreds of physicians have faced criminal convictions related to fraud, and a portion of malpractice claims do involve diagnostic errors. While specific statistics about intentional misdiagnosis for profit are not widely separated out, the reality is that a small fraction of physicians have been found guilty of such unethical practices. It's a reminder that while ethics are central to the profession, there are unfortunate exceptions, though they are relatively rare.